Today, I'm going to tell you about 10 signs of testosterone deficiency. Why does this matter? Because are you watching this video right now, you're probably thinking, I'm fine, I work it out, so my testosterone must be okay. But unfortunately, that's not always true. Testosterone has dozens of functions, and others see guys who in my apartment who have excellent potence and great libido yet still very low testosterone levels. They may look athletic and be physically resilient, but they face other issues that ruin their quality of life. They don't get enjoyment for life and can go years without figuring out what's wrong. Visiting psychologists, running countless tests, checking their life and kidneys, thinking if jobs causing the problem. Sometimes it destroys personal life or career. So today I show 10 signs of testosterone deficiency, many of which be new to you. Watch this video to the end and you understand why you're getting up to use the bathroom at night, why your sexual conscious assurance, and why your working out is improving your physique. The first sign is urination problem. I'm not exaggerating when I say that 17–18% of young men who will be going to doctor for months with a prostate diagnosis didn't equality have it. The real case of their symptom was a testosterone deficiency. They visit all sorts of urologists, free ones, pay ones, but were treated according to old school classic approach. If you're on good on erection, everything fine, no need to check testosterone. Or the doctor simple didn't who know to property in temperature the test. The result the people didn't get the treatment they needed. Who do you know if you have a deficiency? A health man soundly at night. If you regularly getting up and pee in 94% of cases of young men is not prostate, is deficiency of sex hormones. Even if you only get up in tomorrow's morning, it seems it's normal because everything wake up, it's not. It's a warning sign. You need to see a doctor, request tests, or get the dam and lab and confess whether there is deficiency or not. It's not just about wake up at night. Urination problems in general frequent trips to bathroom and feeling that something left after you go. Repeated urge where you rush to toilet but nothing came out and unpleasant and disruptive. Urination with abdominal effort, mainly you have to push with your stomach, or the working urination steam. All of this can be signs a long-time testosterone deficiency. When you live with low testosterone levels for years, the prostate beginning to shrink and shrivel, which can lead to surgery due to prostate sclerosis. His testosterone levels means a healthy prostate, which low levels mean urination issues, impede pelvis floor muscle functions, and poor blood flow. It's not just about potency or libido, it's primarily about organic health. A healthy man doesn't wake up at night to use the bathroom. Of course, if you drink a lot of fluids before bed, that's a different story. Don't rush to check your testosterone after just one instance. Look at yourself over a long period of time. If you know cool drink tea with cookies and not get up at night, but now you were starting to wake up, something has changed. Complete yourself to who you were 10–15 years ago, at 18–20 years old. If this didn't happen before but is happening now, rule in adenoma is very rare at 25–30 years old. In young men, these symptoms are most often linked to testosterone deficiency, which, unfortunately, are frequently overlooked, allowing the condition to worsen. Instead of fixing it with medication, it can end up requiring surgery. The second sign is here, not on your head, but on your face, like your beard. Aside from genetic traits specific to your family, such as having little to beard growth. The growth of beard is often tied to testosterone levels. If you use it to shave every 3–4 days, but now can go 7–10 days without shaving and your stable stays the same, is a sign that something has changed in your body. Facial hair follicles are highly sensitive to hormone changes. Keeping an eye on the growth rate of hair on your face and body. On the body, it doesn't always show up, but on the face is more common. In athletes who use doping conjugate alopecia infrequent due to high testosterone doses, ordinary people in make-believe to elevate the testosterone on the sensitive to hair follicles. If your father or grandfather has this is genetics and fighting it is safe. Some mistakenly take drugs that block testosterone stop hair loss, hair stop falling out, but the prostate is clearing and after 4 year surgery because necessary. The first sign is the inability to lose weight. There is elementary obesity where a person doesn't move much and eats a lot, but there is another kind too. I can't just be look at someone is a whale in a free clinic fat deposit where shows be abdominal obesity a big belly. The normal waist size for men is up in 94 100 centimeters, but the point is the shows be a large belly. If the fat protrudes from the inside rather than hanging under the skin, is a dangerous type of obesity. It the shortens your lifespan, surround your organs, damages blood vessels because it's hormonally activity fat. It can get rid with the exercise or cardio. You might exhaust yourself, but it just swaps one harmful state for another. If you have a big belly but thin arms and legs, check your testosterone. It's one of the clinical signs of its deficiency. In powerlifters with heavy weights, this might be due to insulin, but their bodies grow proportionally. We're talking about pathological fat accumulation here, a thin body with a belly slipping over the waist. The first sign is the health of joint and ligaments. A man who surfs, runs, exercises, and casually follows a diet starts to experience knee pain. This is typical unless usually suffer from exercise, weight, or specific loss. If you're just leading an activity lifestyle and your knees hurt, something off. When ligaments and joint already in pain, it means the testosterone deficiency has been going on for a while. The pain doesn't show up right away. The reversity of your ligaments depletes gradually, and if you don't catch the problems in time, reversing is because deficiency. If you constantly gain ages without obvious reasons, check your testosterone. This is important because the ligament reserve is infinite, otherwise it's called to reach a point where there is nothing left to operation on. The fifth sign is thinness and sarcopenia, meaning an efficiency in muscle mass. They use it to think that testosterone deficiency means a heavy man, but it can be the opposite, someone everything without muscle, with skinny arms and legs. A person with weight 45-15 kilograms at everything say trains but see no progress. These people can spend years working out with no results, restore their testosterone at normal levels, and their life changes from before to after. We're not talking about steroid cycles here, but about health and bringing hormones back to normal. The sixth sign is sweating. You hard to reach. Sometime in a room the 24 degrees Celsius, everyone feel comfortable, but one person in constantly vaping swim from the forehead, feeling hot and deranged. With the testosterone deficiency, thermoregulation gets disrupted. You feel hot to you even when it's not. Conversely, you feel cold when it's warm. Pay special attention to nighttime. If you wake up in a pool of sweat, it's a sign that something off with your hormones. This may not be related to air temperature, but the cold steam for exercise. With hands a flushed face, hot flashes, or a constantly feeling of cold. These are signs of testosterone deficiency or favorite hormone issues that you may not have considered. The seventh sign is physical and mental exhaustion. People with a testosterone deficiency don't find joy in life. They don't want to do nothing. The reward system for attention is disruptive. There is no endorphin rush from playing football, meeting friends, or enjoying hobbies. Trips of fishing used to bring happiness, but now you just want to lay down and do nothing. Even things that interest you feel draining. If this part of your life, check your testosterone. But I am not saying that yesterday laziness is a reason to rush and get tested. The deficiency develops gradually and that won't makes it sneaky. You may not notice the changes for years, as it means they're normal. There are questions like the AMC, aging male symptoms. Take one, save the result, and compare them in 2-3 years. The eighth sign is sleepiness or sleep disturbance. As a strong deficiency after sleep, you feel drowsy during the day, but at night, despite being tired, you can't fall asleep. Or you wake up multiple times during the nighttime. Sometimes men can go years sleeping only 2 4 hours a day, but after hormones correction, they stay sleeping soundly. And sleep issues, daytime sleepiness, insomnia, or freaking waking could be linked to testosterone. The ninth sign is libido and potency. This is a deficiency state. You may want to be can't, or you can be want to. If the desire for sex fades, erection becomes less frequent. Spontaneous erection waking, fantasy dull, and sex depends on your partner's initiative. This is a sign of a deficiency. Even if sex once a week suits you, it could be a symptom of a issue that's quality undermine your life. Change of organs quality, pull with muscle tone, on prostate functions are reasons to get checked. I'll provide a list of testosterone in the separate video about females and male hormones, when I'll explain how to properly take in the temperature them. The 10th sign is depression, moral exhaustion, and the feeling that you will hit rock bottom. Many people spend years seeing psychologists and neurologists taking medication, but after restoring testosterone, the need for the therapy disappears. If you experience these states, check your hormones. I'd like to ask you share in the comment one change for the worse in your life over the past 10 years. Maybe you will start getting up to use the bathroom more often, stupid sleeping well, when run like you use it too, or the lost the ability to quickly get the shape. Shape your stories, admit a courage others they get checked. I'm looking forward to hearing from you.